starting with some promising new research into the popular drugs Ozempic and Wegovy. There's a study that was published in the Journal of Alzheimer's Disease that found may have other benefits beyond weight loss. The active ingredient in both medications may actually lower the risk of developing dementia. NBC News medical contributor Dr. Natalie Azar is here with us this morning. Dr. Azar, good to see you.
Good morning, all of you.
Okay, so walk us through what this study found.
So this was a really interesting one. So they looked at the medical records of over 1.5 million people who had type 2 diabetes, and they compared the outcomes or the incidence of what are known as Alzheimer's-related dementias, most commonly vascular dementia, in people who were taking either semaglutide versus metformin versus insulin versus some older GLP-1s. And they found that the people who were taking semaglutide, like Ozempic or Wegovy, had a lower overall incidence of Alzheimer's type dementia.
Did the doctors say or the researchers say what they thought were behind
what the reason, right? So I think if you start with this concept that the risk of dementia is increased in individuals who have diabetes, who are obese, who have high blood pressure, high cholesterol. All of these things increase the risk of vascular disease, which can increase the risk of dementia. So logically, it follows that if you reduce all of those risks by taking a medicine like semaglutide, Ozempic or Wegovy, that down the line, you actually might mitigate or offset some of that risk for dementia that would otherwise be conferred by having all of those vascular issues.
How long do you actually have to take the medicine to see the benefits?
Well, so here, these individuals were on these medicines for 3 years. And what they showed was what kind of interesting, that even beyond 3 years, that slope, that incidence of Alzheimer's related dementia kind of continues to decrease. So the longer you're on the medicine, theoretically, you could mitigate that risk even further. But these individuals were followed for 3 years.
Wow.
Besides dementia, there's also been some findings about heart health in general.
Yeah, right. And so, you know, this was already, I think, almost a year ago. Well, Ozempic has already been approved to reduce the risk of heart disease in people who have type 2 diabetes. Wegovy has been approved to decrease the risk of heart disease in people who are at risk but don't have type 2 diabetes. And recently, the American College of Cardiology said, listen, if you have a patient who is overweight and you want to reduce their cardiovascular risk, you don't need to wait to start them on Ozempic or Wegovy, demonstrating that they have failed lifestyle interventions. You can just, out of the gate, you can start them on a GLP-1 in addition to those lifestyle and behavioral interventions.
I'm so curious because there are a lot of folks on these drugs, but there are a lot of folks not on these drugs.
Yes.
Should everyone be taking them to reap all the benefits, you know, to stave off dementia and heart
and all of these other things.
That.
So we have spent quite a bit of time on our air as well, talking about all the potential benefits of GLP-1s that go beyond weight reduction and treating type 2 diabetes. We have data on dementia, arthritis, obesity-related cancers, and it begs the question, are all of these benefits, like dementia, are they related to weight loss alone, or is there something else going on? I think of it as something that's dependent on the weight and independent of weight loss. So I think right now, this was a very at-risk population, right? These are individuals who clearly were at risk for dementia. If you think about it this way, about 45% of cases of dementia are preventable by modifying risk factors. So that means obesity, hypertension, high cholesterol, smoking, exercise. There's things you can't change, like genetics and age.
Right.
We don't know whether, if you already are not obese and not hypertensive, if taking a medicine like this will prevent dementia. There's no evidence to suggest that. But I think this is the tip of the iceberg, potentially, of all the other benefits that these medicines may confer, not just because of weight loss, but also because they're reducing inflammation and a whole host of other things that we're learning about right now.
Dr. Natalie, thank you.
You are very welcome.
Thank you so
Very
much.
helpful. Thank you.
Hey, thanks for watching. And don't forget, you can catch the Today Show every morning on NBC or take Today when you're on the go. Just follow the Today podcast on Apple Podcasts, Spotify, or wherever you listen.